Assessment, we have to take the history, full history, the past history, and important thing, we have to assess the cause. What the medication the patient taking, the blood transfusion, radiograph contrast that may cause lung injury, use of medical therapies, social factor, risk factors for ARDS. Also, diagnostic tests that are important, like ABGs, arterial blood gases, hypoxemia present. The PaO2, as we said, may be less than 60 millimeter mercury and could be refractory hypoxemia. At early stage حكينا respiratory alkalosis نتيجة الرابد respiratory rate بقل CO2 لكن في later stage respiratory acidosis. Radiographic changes, early patches أو patchy bilateral infiltrate تراكم السوائل على البوت lung, diffuse infiltrate and consolidation, damaged lung tissues. Daily X-ray to evaluate the progression of the disease. This picture clarifies the X-ray and the white area at early stage and later stage. The interstitial marking and the edge of the diaphragm and the ribcage may disappear. The edge of the heart. Here in this picture, the edge of the heart appearing. حواف القلب ظاهرة, حواف الديافرام ظاهرة, لكن later stage these interstitial marking will disappear. The normal X-ray, the edge of the heart, the edge of clavicle, the edge of diaphragm appear, while the picture on RDS, there are no interstitial marking, whitish area, bilateral infiltrate that appear on both lungs. The sign and symptom for patient with ARDS included tachypnea, dyspnea, nasal flaring, and respiratory alkalosis, cyanosis, moist skin. Tachycardia to compensate for decreased oxygen supply, hemoptysis, crackles, agitation, lethargy, and decreased level of consciousness because the oxygen supply to the brain may decrease. Intrapulmonary shunt measurement. Intrapulmonary shunt is a type of ventilation perfusion mismatch. وشرحنا سابقا عن الشنت والديد سبيس كأسباب أو changes اللي بتؤدي إلى ventilation perfusion mismatch في محاضرات سابقة. As the percentage of cardiac output that is not oxygenated owing to pulmonary blood flowing past collapsed or fluid filled and non-ventilated alveoli, وهذا سميناها physiologic shunt. وشرحنا شو معنى physiologic shunt, إنه جزء من blood will return from the right to the left side of the heart without being adequately oxygenated because of the defect in the alveoli or in the lung. Absence of blood flow to ventilated alveoli, alveolar dead space, or combination إنه defect في الفنتيليشن أو البيرفيوجن سميناه برضو silent unit, alveoli with no ventilation and no perfusion. لكن إذا كان برضو اللي هو dead space هو مثال على إنه في ventilation لكن ما في perfusion, ومثال على ذلك pulmonary embolism, وكلاهما كله يؤدي إلى defect في الفنتيليشن أو البيرفيوجن أو both, سميناه shunt dead space أو silent unit. يكون عندنا physiologic shunt و dead space مع بعض. Intrapulmonary shunt of 3 to 5% is present in all people, which is normal. إنه small little amount of blood return to the left side without being adequately oxygenated أو having adequate amount of oxygen. However, advanced respiratory failure and ARDS are associated with a shunt of 15% or more due to the changes in blood flow, endothelial disruption أو alveolar collapse. إذن قد تكون المشكلة بالبلد فلو في البرفيوجن أو قد تكون بالalveolar collapse بالventilation, or both in blood flow and alveolar collapse, which indicates silent unit. As the intrapulmonary shunt increase to 15% and greater, more aggressive interventions are needed, including mechanical ventilation. Because this level of shunt اللي هو 15% بكون عادة مع profound hypoxemia لأنه كمية كبيرة من الدم سوف تعود إلى left side without being adequately oxygenated. Measurement of intrapulmonary shunt requires the use of pulmonary artery catheter. The intrapulmonary shunt fraction QS by QT is calculated using arterial oxygen content اللي هو CaO2, the mixed venous oxygen content اللي هو CvO2, and the capillary oxygen content اللي هو CcO2. مهم جدا نعرف هاي الاختصارات. لما حكينا arterial oxygen content حكينا عن Ca. A من arterial, C من content. arterial oxygen, C content. mixed venous oxygen content بنحكي عن V من mixed venous, O2 oxygen و C content. and the capillary oxygen content بنحكي عن CcO2 وال O2 في الكابيلاريز والC الكابيتالال content. Oxygen content is determined by hemoglobin also لأنه حكينا الهيموغلوبين is responsible to transport the oxygen to the tissues. فأول عامل يؤثر على الأكسجين content هو الهيموغلوبين. العامل الثاني هو الأكسجين saturation SO2 واللي قلنا يتم قياسه بالبلس اوكسيمتري أو عن طريق الارتيريال blood gases, and the partial pressure of oxygen ال PaO2 والذي يتم قياسه عن طريق ال ABGs. measured by calculating the oxygen content in وين بنقيس الاكسجين content في البلمونري capillary beds, in systemic arterial system, and in mixed venous blood from pulmonary artery. إذا من خلال هاي العينات بنقدر احنا نحصل على النقاط اللي حكيناها في السلايد اللي قبل هيك اللي هي الارتيريال oxygen او arterial oxygen content, mixed venous oxygen content و capillary oxygen content. The intrapulmonary shunt fraction may also be estimated using the ratio اللي هي PaO2 لل FiO2 ratio اللي شرحناها سابقا. زي ما حكينا the normal ratio هي أكثر من 300, ال PaO2 لل FiO2 هي أكثر من 300. Value of less than 200 are associated with an intrapulmonary shunt of 15 to 20%, and a value of less than 100 is associated with a shunt of more than 20%. يعني كأني بقول لك 20% أو أكثر من الدم will return from the right side to the left side without being adequately oxygenated if the ratio between the PaO2 to FiO2 أقل من 100.